Say that my
Why don't you say it
opinion
again,
was
sir?
yes, I'm happy to. My opinion was that, and is, that she suffered from a major depressive episode, and that was a part of major depressive disorder.
Well, looking at your reports, sir, on your conclusions, would you agree with... So do you have your report?
He's reading from the wrong report.
Do you have your report, sir?
Counsel, can I see it sidebar just for a second?
It's not the wrong report. Sir, you would agree that your opinion on page 35 is that at the time of the incident, that Lindsay Clancy was suffering from a mental disease, and then you have the opinion, however, she retained substantial capacity to appreciate the wrongfulness or criminality of her conduct. Is that correct? Did I read that right? And the mental disease from which she suffered, in your opinion, was a mood disorder, major depressive episode. Is that right?
Yes.
And you further opined that she may have also had an anxiety disorder that preceded or continued to be present while the major depressive episode proceeded through January 24th. Is that right?
Yes.
Okay. Now, you're aware that she has been at Tewksbury under a particular diagnosis of a mental disease or defect, right?
Yes.
What is that?
I believe it's adjustment disorder.
Adjustment disorder. Is it not your understanding, sir, that she's suffering, according to diagnosis, bipolar disorder?
I think you'd have to show me where you're referring to.
So, did you have a chance to review Dr. Helbrin's report?
I did.
And do you know what Dr. Helbrin's opinion was of the
In
diagnosis?
terms of
Diagnosis.
Yes.
What was it?
I think he made a diagnosis of bipolar type 2.
So you have nurse practitioner Gelada, who, as a treating practitioner, indicates that the diagnosis possibly is bipolar disorder, correct?
I don't know that she used those terms, but I know that she was concerned about the possibility.
And you know, because you've obviously read and incorporated into your report Dr. Resnick's opinion, correct?
Correct.
And what is Dr. Resnick's opinion, sir, to your understanding?
In terms of the diagnosis?
Yeah.
Bipolar type 2.
Okay. How about Dr. Zeisel? You also had access to and incorporated into his report, your report, his diagnosis. What was that?
Now, offhand, I don't remember what his diagnosis was.
How about Meg Spinelli? Did you have a chance to review her report and incorporate that into your report?
I reviewed her report.
Do you know what her diagnosis was, sir?
I believe it was bipolar type 1.
Right. So with all of the various healthcare providers that have an opinion of bipolar type 1, would you agree that that is a very strong indicator that a person could very well be suffering from postpartum depression?
I'm confused by your question because that last piece is not necessarily inconsistent with the diagnosis of major depressive episode.
I'm asking you, sir, about
what I discussed the other day was when that specifier is able to be used, that would be a diagnostic question.
So with the understanding that nurse practitioner Gelada is bipolar, or looking at bipolar, that Zeisel report, you don't know or recall what it is, but you incorporated it into your report. Dr. Resnick is bipolar 2. You feel that this is or is not indicative of a precursor to a person suffering from postpartum depression? It's in the books. in the articles, right?
Your use of terms, to me, seems apples and oranges. The question of postpartum depression would be, does the person have a mood disorder, and is it in the time frame following birth?
I can't hear you. I'm sorry.
So,
I can't, can you say that again, please?
we're talking about categories that are not aligned with each other.
No, I'm asking you what your answer was,
Diagnosis.
okay? What's your answer?
You'd have to restate the question.
Okay. You recall Friday, sir, that you were talking about onset of postpartum depression symptoms occurring within a particular time frame. Do you recall that, sir?
The diagnosis would be
My
a
question is
depressive
simple. Do you
episode.
recall saying what the time frame was Friday?
I'm trying to answer your question.
What is the time frame?
The time frame designated for the diagnostic specifier called with postpartum onset is 4 weeks.
Okay. And that's your opinion, right?
Well, I believe that's what the DSM says.
Okay. So let's talk about
the 4 week period. The 4 week period in which that specifier may be added.
Okay. You recall saying
The
that
diagnostic rule.
you recall saying that a person can be postpartum and it has to be within 4 weeks. You recall saying that Friday?
What I would have intended to say.
No.
Which I believe
What did you say to the? Come on. What did you say to the
All right,
jury
hold on,
last
hold on.
Friday?
Doctor, please listen to the question and just answer the question as asked, okay? And then if the Commonwealth has any redirect, they can follow up with their questions. Go ahead.
Thank you. Do you recall saying that the person has to be postpartum within 4 weeks, according to the DSM? Recall saying that?
To meet that specifier, yes.
Right. Well, do you understand, sir, that every woman that has a baby for the rest of their life is postpartum? Because postpartum, quite frankly, means having a baby, right?
Sure.
So,
But that wouldn't be the specifier of with postpartum onset.
yeah, but you
in the
can't.
DSM.
Postpartum is not a disease, doctor. Postpartum.
Right. It's an appellation that is defined in terms of 4 weeks.
Okay. According to you, right? You understand that World Health Organization is different, right?
If you're talking about the ICD,
What is that time frame, sir?
I'm not sure what it is. I think you said it was 12 weeks.
How about the proposal to amend the DSM-5 text revision, or TR? What's the proposal for that?
Well, there's a proposal specifically around the proposed diagnosis called postpartum psychosis, and for that, it's a 6-week period.
So you've got 4 weeks, you got 6 weeks, you got 12 weeks. Would you agree, sir, that postpartum depression, postpartum psychosis can occur up to a year or even a year or longer?
I don't know, but I am telling you what the DSM says in terms of how to diagnose it and how to code it.
Okay. You would agree, sir, that she is at Tewksbury with a diagnosis of bipolar, right?
That may be among her diagnoses.
Okay. And she's on medication, right?
Yes?
And she hasn't had, over the past 3.5 years, any problems with sleep, anxiety, depression, symptomology of the same while she's been medicated at Tewksbury, right?
She has not demonstrated any signs of mania.
And she hasn't demonstrated any signs of anxiety either, has she, while she's been on the medication, the right medication, right?
I note that she's complaining of anxiety. I'm not sure she's demonstrating signs of anxiety.
Other than the fact that she's paralyzed and has to be in a wheelchair, she's not exhibiting the inability to bathe, the inability to emote, to have feelings, to talk to people. She's able to communicate with people, right?
Yes.
Okay. Do you know what medications that she's on while she's at Tewksbury?
She's taking, I think we discussed this the other day, a low dose of Zyprexa, I believe clonidine and trazodone, and propranolol occasionally.
Okay. Now, after you had a chance to review the medical records from Dr. Tufts, which would be from end of September of 22 up through October of 22, for example, initial prescription, right?
I reviewed all of the records from Dr. Tufts, yes.
And you recall what the first prescription was that she got, right?
Sertraline?
And that would be what, 25?
Yes,
Was that increased?
it was.
And was there an issue or a problem, according to Lindsay, when that was increased from 25 to 50?
Yes.
And what was the problem that she indicated to the doctor?
She wanted to sleep, but she was finding it hard to sleep.
She was unable to sleep for a period in excess of 48 hours, is what she said, right?
I think it was at that point, yes.
And also, she indicated that there was, in her opinion, a symptom that she didn't really have a need to sleep, even though she had gone 48 hours without sleeping, right?
No, she wanted to sleep.
Well, would you agree with me, sir?
She was tolerating, she described that she was tolerating during the daytime and functional sufficiently without the sleep, but she found that she was trying very hard to sleep and she couldn't sleep.
And do you recall her indicating that she did not feel, regardless of 48 hours straight without sleep, that she had a need? She said she didn't feel like she had a need to sleep. Did you see that in the records?
I'm not sure that it would be characterized that way.
Did you see? Okay. Did you see anything in the records?
Wanted to sleep.
All right, one at a time. Go ahead, Mr. Reddington.
Did you see anything in the records that indicated that she complained of the fact that she had gone 48 hours without sleeping after she was on the sertraline, and then felt that she did not need to sleep, even though she'd been without for 48 hours?
I don't exactly recall what was written by Dr. Tufts, but she described to me that in that period...
Doctor, I'm asking you about the medical records, not what you think she told you 3 years later. The medical records.
The medical records review the fact that she was not able to sleep.
And would you agree with me that one of the symptoms, sir, that you would be concerned about as a psychiatrist is when a woman who is postpartum, after having a baby, is complaining of a number of symptoms, one of which is that she went a long period of time unable to sleep, but didn't feel that she had the need to sleep? That's textbook, isn't it?
Well, the DSM textbook refers to a decreased need for sleep as the seventh element of mania.
Okay, so that is an indicia of mania. Can I get that out of you?
The way it's written is a decreased need for sleep.
Okay.
I don't know that she had a decreased need for sleep.
And in the medical...
trying very hard.
Go ahead.
I think she desperately wanted to sleep.
Is that what you think, sir, or is that what your opinion is based on the medical records?
That is my understanding based on the totality of the information.
Okay. So is it your understanding that she also exhibited signs or symptoms of postpartum depression?
So to the extent that she had depression in a period after having had a baby, that is not how DSM would refer to it, but as you said, everybody would be postpartum in that regard. So my opinion is that she had major depressive episodes in this year or within 4 or 5 months following birth.
Sir, you're familiar with the postpartum psychosis. You're familiar with that, right?
So there's the concept of having psychosis.
Are you
in
familiar
this
with
brand.
postpartum psychosis, sir? Yes or no?
I'm familiar with a proposed diagnostic entity called postpartum psychosis, and the idea that people can have psychosis as a mental disorder at other times.
You're familiar with the Department of Mental Health in Massachusetts, right?
Yes.
You're familiar with the funding of the Department of Mental Health for the Massachusetts Child Psychiatry Access Product. You're familiar with that, right?
No.
Called the MCPAP, that focuses on postpartum psychosis and postpartum depression. Are you familiar with that, sir?
No.
Would you agree with me that when a person has a child and is within the postpartum period, that they may present to a doctor with symptoms that might lead the doctor to believe that they are suffering from postpartum depression? Would you agree with that?
I'm not familiar with that particular program. I'm happy to.
All right, I know you're happy, but I'm just asking, sir, about postpartum depression. Forget the program. You're not familiar with the program. We get it. I'm asking you now, sir, about your familiarity with postpartum depression.
Yes.
Okay. And there are symptoms of postpartum depression. Fair to say?
Postpartum depression.
Are there symptoms, sir? Yes.
I am familiar.
Okay. And forget the DSM. Let's just focus on the symptoms as you understand it for postpartum depression, which, according to you, has to occur within the first 4 weeks of birth. But quite frankly, it could be 6 weeks, it could be 12 weeks, it could be a year, right?
You said forget the DSM, except that making diagnoses in psychiatry requires an authority, and we utilize, in this country, the DSM.
Maybe we shouldn't?
So,
All right, sustained. Next question.
So you're familiar, sir, you're not familiar with MCPAP for mothers in Massachusetts. You're not familiar with that subsidiary of the Department of Mental Health, right?
no.
Are you familiar with the Department of Mental Health postpartum psychosis provider training? In other words, what the LISCWs are learning and what the psychologists or psychiatrists working for the DMH are learning about postpartum depression, postpartum psychosis. Are you familiar with those standards?
No.
How about the Edinburgh postnatal depression scale? We talked about that Friday. You're familiar with that, sir?
I am.
But you don't feel it's important. You think the regular GAD scale, general anxiety scale, is sufficient, I guess, right?
I don't think I said that.
Oh, okay. So do you think that the Edinburgh postnatal depression scale is important as a tool for a diagnosing physician dealing with a woman that's within the time frame and exhibiting symptoms of postpartum depression?
Yes.
Okay. So what was Lindsay's scale, if you know now? You had the weekend, I imagine, to look it up.
I don't offhand know what it was.
Okay. So if I offhand told you that it was pretty much off the chart, would that have any impact on your opinion as to the utility of the postnatal depression scale that was administered to her?
That's not a form of the question.
No, sustained. I mean, overruled. Me ask. Sorry.
It's a scale that elicits distress, which she had, and it elicits depression, which she had.
And it's not just limited to distress and depression. It's focused on, and again, I'll read it, the Edinburgh postnatal depression scale, right?
Right.
So, no, the answer's right.
She had diagnosis of depression. She was being treated for depression.
All right. So you, in any event, you don't utilize, apparently, the EPDS, right? You don't utilize it in your practice, whatever that may be.
Correct.
Okay.
Not that I'm against it. I just haven't had the opportunity to use it in some time.
Right. Just like you think that, an episiotomy is a tear, I guess, when a person has a baby, right?
I'm sorry?
You remember Friday you said that when a baby is born and the woman suffers a tear, that you called it a particular name?
An episiotomy.
Right.
When there's a need for a tear, there are several different degrees.
No, wait a minute. Hold on now. Hold
one
on.
can have.
Excuse me, sir. Friday you said that the episiotomy is, in fact, a tear. Do you remember saying that?
I'm not sure exactly the wording.
Did somebody tell you that you were way off base on that testimony Friday, sir?
I'm not sure what you're referring to.
I'm referring to you saying that an episiotomy is a tear. And it's not.
And, Your Honor, is there a question before the witness?
I already asked the question. I'm looking at him staring back at me.
All right, I want you
The last,
just hold on. Well, you can rephrase that.
Do you remember saying Friday that episiotomy is a tear? Do you remember saying that to this jury, sir?
I don't remember the exact words that I stated.
Okay. Did anybody
After a tear.
did anybody over the weekend tell you that in fact you were wrong and that it is a surgical procedure and that a natural tear has nothing to do with that procedure other than repairing? Did anybody talk to you about that at all over the weekend?
No.
Okay.
No.
So you would agree with me, at least, that postpartum depression, even though you don't use the EPDS, does have symptoms that a doctor would consider if a patient came to him or her for help, right? Yes or no?
So-
Yes or no?
You're asking me about a condition which
Right.
is not the way that it's defined.
I'm asking you, sir, whether or not you understand as a doctor that if a woman has a baby and comes to you because she is in trouble, that you would look for symptoms, would you not? Yes or no?
Yes.
Okay.
Yes.
And if the woman told you that she was less able to laugh, no emotion, unable to see the funny side, is that a symptom, sir, in your opinion, of postpartum depression? Yes or no?
It's a symptom of depression.
Was Lindsay Clancy complaining that she was unable to laugh or emote or see the funny side, if you will, of life when she went to see Dr. Tufts and Dr. Gelada? Do you recall that, sir?
Yes.
Okay. Okay, so let's just say the next issue would be stopped looking forward to things. You're familiar with that? People don't look forward to things, and they, what is that called? Anhedonia or something like that?
Right. So that was one of the several elements of major depressive episode that I referred to the other day.
Right, but it's also one of the symptoms of postpartum depression, correct?
They are the same. When
Okay.
you have depression and you meet the qualifier, then you can call it depression with postpartum onset.
How about a person that comes to you and says that they're anxious and worried constantly for no good reason? Would you agree, sir, yes or no, that that's a symptom of postpartum depression, according to the authorities?
So,
Can you answer that yes or no, sir? It's real easy. Sir.
And if it,
All right, hold on. If you can't answer the question as asked, doctor, just say you can't answer it as asked, and I'll ask counsel to rephrase it. Go ahead.
yes.
So would you agree with me, sir, that the next symptom of postpartum depression would be anxious or worried for no good reason?
So I can't
that-
answer that question.
You can't. You can't?
I said I can't.
Okay. Was Lindsay Clancy expressing to the doctors and the nurse practitioners and the LICSWs or whatever on the medical records that she was anxious and worried on a daily basis for no apparent reason?
Yes.
Did Lindsay Clancy also indicate that she would have episodes of fear or panic for no good reason?
Yes.
Did she also indicate, sir, that she was overwhelmed by life, basically, overwhelmed?
Yes.
Did she also indicate that she was so unhappy and worried and anxious that she had trouble sleeping?
Yes.
Did she indicate that she was sad or miserable and unable to enjoy things like family, friends, society?
That is a symptom that progressed as those months moved on, yes.
Sure did. Did she also say that she's unhappy? She was so unhappy that she was crying on a daily basis.
Yes.
Did she also indicate that she had thoughts of harming herself?
Well, or suiciding, yes.
So if she's successful in harming herself and she dies, then it's suicide. Either way, it's a thought of harming herself, right?
I don't think she had the interest of harming herself simply for the interest of harming herself. She had the interest of suiciding.
And she wasn't successful, obviously, right?
Are you referring to January 24th?
So the postpartum depression, sir, which invariably involves the EPDS, which you don't use, consists of 1 to 10 symptoms, and she hits every one in the medical records that you reviewed. Is that correct?
First of all, I'm not sure what you're... Well, I can't answer the question as you've asked it. I'll put it...
Let's talk about postpartum psychosis, because that is something that can follow postpartum depression. Is that right?
You're using terms that make it that I can't answer your question.
Postpartum psychosis, you can't answer? You know what that is, don't you?
Are you referring to the proposed diagnosis that we referred to earlier? The one
I'm referring to the fact that this young lady was suffering from postpartum psychosis when she killed her kids. Do you know what postpartum psychosis means?
So there is a observation that a person may have psychosis, or there is the proposed diagnosis that we referred to the other day.
Let's do this. Symptoms of postpartum psychosis. Number 1, hearing voices. Would you agree, sir, that hearing voices is indicative of having a symptom of postpartum psychosis?
You're referring to a condition or an illness called postpartum psychosis, and I don't know that I can answer questions as a psychiatrist based on that.
Would you agree, sir, that when a person is suffering from postpartum psychosis, you understand that term, do you not?
When we elicit...
Do you understand the term postpartum psychosis? It's real easy. Do you understand that term?
It's actually not easy. It's serious, but when we do elicit psychosis after a birth, we take it very seriously. Typically...
Who's we? Who's we? We take it seriously. Who's we?
We psychiatrists, I as